Right, I think let's make a slow start then, and I'm sure anyone else can join as we move on with the webinar today. So first of all, I just want to say good afternoon and thank you for attending today's webinar. I appreciate how hot it is today. I'm really trying not to complain because we don't get it all the time, but we do really appreciate you taking the time to be with us here today. I am going to introduce the team very quickly. So my name is Charmaine Jackson and I head up the training team for Ardens. Hopefully I've met quite a few of you already. We've also got Mariette Hadfield, who you can see on screen. Mariette is one of our training specialist leads. And we're also joined by Hazel Quick, who is another one of our training specialists. And Hazel's going to be helping out with the questions in the Q&A. And I'll talk about how you can work that in a bit when we do the housekeeping. Now, this webinar today, it focuses on an introduction to QOF. So what we're going to be doing with you is we're going to be going right back to basics in this webinar. We are assuming that those of you that have joined today, that you are completely new to QOF, or it might mean that you have very limited knowledge, or perhaps you've had no training ever and you want to make sure that you're on the right track. Now, if you are quite an expert on QOF already, and if you use it day in and day out, you may not find this as beneficial, unfortunately. We do have other QOF webinars that we're doing throughout the year, and I'm going to get Hazel to post the link to how you can book on to all of our future webinars, because you may find them a little bit more helpful than the one today, because we really are going back to basics in this one. So for instance, on Tuesday, we're doing a webinar all around how you can use our resources to plan QOF for the year ahead. So that may be more suitable for you. So if you've reached so far and you think, actually, I am an expert, don't worry if you have to drop off. We won't feel offended at all. It's just the red leave button if you need to come out of the meeting. Otherwise, everyone else, be with us, and hopefully this will be useful for you. Now, the webinar is going to be very interactive, as I mentioned. I will talk about what that looks like in a minute. And it's open to all customers. So it doesn't matter whether you're an EMIS customer, a System 1 customer, everything that we cover today will be quite generic content. We're only going to go into the Ardens resources only a little bit. It's more generic content that we're going to be covering with you today. So that's the introduction then. So in terms of housekeeping, you're not connected to a camera or a microphone. So if you have any questions that you would like to answer, or if you've got any feedback throughout the webinar, then you can use the Q&A option. And that's the area that I mentioned that Hazel is monitoring. So therefore, take some time, make sure you know where that Q&A option is, because that's going to be really important for you if you need any extra support throughout this webinar today. The session has been booked for 1 hour, and we are going to keep to that time as much as possible. And it's going to be recorded. So after the webinar, at some point this afternoon, perhaps tomorrow, what we will do is we will email out the recording to everyone that's joined the webinar today. It will be available on our knowledge base site, and I am going to get Hazel to pop a link in so you can find out as well where you can find all of our recorded webinars. So I mentioned it's going to be interactive. So every so often, I'm going to fire up a poll question, which will just come up in the middle of your screen. And we're just going to answer a few questions about what your role is, what your confidence level is. It's nothing too hard at all. And then we will move on to just a few knowledge check questions throughout the session, just to make sure that you're happy with your understanding. But it's completely anonymous, so please don't feel like we're testing you in any way. We just want to make sure that you walk away feeling confident, more confident than you were when you joined this webinar today. Now, what we're going to be covering, so like I mentioned, we're going back to basics. So the aim is for you to walk away feeling like you're confident in knowing the key principles of QOF. So we're going to look at what is QOF and why does it matter. So it's really important to help you understand the significant part it does play in your practice, both for patient care and for the income that's coming into your practice too. We're going to look at how QOF actually works, look at the structure, because we want to help you understand what you're working towards, what your practice is working towards. We're then going to look at the most important part, which is recording data. It's really essential it's done in the correct way. And actually, everyone plays a key part in making sure that data is captured. So we're going to look at that today as well. We're then going to look at monitoring the QOF progress, so how your practice will understand if they're on track or not. And then we're going to finish off with next steps, and we're going to look at some ongoing training and support that you can take from this webinar here. So hopefully that all sounds okay for you. Make sure that you reach out if you need any further support. And I think at this stage, Mariette, it's probably really helpful if we actually just share the first poll question to understand who we have in the room. So Mariette's just going to launch a poll question now. It's going to answer you what your job role is. If you just select one of those options there, that would be great. And Mariette, if you can just give me an idea of what the results are that come back through.
Okay, that poll should now be live. So far, mostly administrators, 44% administrators. We've got some care coordinators, a couple of GPs, a couple of nurses. Yeah, so practice managers.
Quite a mixture then.
Yeah, quite a mixture.
More admin
than clinical.
It sounds, yeah, which is what we would have expected as well. Okay, thank you for that. So now we know who we've got in the room. If you've said other, just pop it in the Q&A, because then that will help us understand what roles we are also supporting too. So just in the Q&A, pop your role in there. That'd be really good. Now, the next question we're going to answer you is, how confident do you feel with your knowledge of QOF right now? So that's the understanding the principles. How confident do you feel? Number one, totally confused. If you're totally confused, that's absolutely fine, because you're in the right place. Hopefully we will help you grow in that confidence. Maybe you're somewhere in the middle, or perhaps you're number 5, you're really confident and you can go away and you could explain it to someone else. So I'm just going to get Mariette to launch that question for me, and then we can have a look at the results.
So quite a mixed bag. We've got a few people who are at a 5.
Okay.
But most people sit sort of in the 2s and 3s.
Okay, cool. We
have definitely some that are totally confused.
Cool, in the right place then. So what we'll do is we'll run that question again at the end of the session, just to see where you're all at. Thank you for doing that. That's great. So back to the beginning, or right to the beginning, should we say, and what is QOF? Now, even if you have very limited knowledge in this area, you probably would have heard the term QOF being bounced around in your practice. You probably would have seen the manic rush normally at the end of the financial year, where everyone is trying to work towards getting those last few points. So what QOF stands for is Quality and Outcomes Framework. Now, you will never ever hear anyone call it Quality and Outcomes Framework. You would generally hear people refer to it as QOF, but it's just nice for us to understand that that's what that means. And what it is, it's a national program that has been set by NHS England. So it's mainly for, well, it's only for GP practices, and it's mainly in England, but you will find that practices in Wales and also practices in Northern Ireland are also working towards something similar, but they just call it something different. But for QOF, that's mainly in England that we're working towards for that. It's actually been running since 2004, so it's been running for quite some time now. Like I mentioned, it's only for GP practices, and the whole aim of QOF is to improve the quality of patient care. So that's what we're working towards. What it does is it focuses on chronic conditions, or you may know it as long-term conditions. It's the same thing. So that's patients having the right care for the conditions that they have. So for instance, I've got asthma, making sure that I have all of the relevant treatment that I need to manage my asthma, etc. And then it also focuses on public health concerns. So that's trying to help our population reduce the amount of smokers that we have, or reduce obesity, or even providing vaccination so it prevents any future diseases for that patient. So that's what public health side of things is looking at. Now, what it is, for QOF, practices are working towards particular targets, and we'll talk all about that in a minute when we talk about how QOF works. So they're working towards these targets, and then at the end of the year, in turn, practices are then rewarded for their effort. And again, we'll talk about what that looks like as well. It's important to note that QOF runs on a financial year basis. So it starts on the 1st of April, and it runs all the way to the 31st of March, hence why sometimes there's a manic rush in the last 3 months. And every year it will reset, and it may change depending on what the NHS England's focus is. Sometimes they reduce some of the targets we need to meet, sometimes they increase it. It just depends on, like I mentioned, what the focus is. And believe it or not, it's actually voluntary. So GP practices don't actually have to sign up for it, but it's such a massive income to the practice. You probably find that there's no practice that doesn't sign up for QOF. So even all of you on here, if you go back to your practices, I'm sure they're using QOF, hence why they wanted you to come onto this training session today. Now, I'm quite a visual person, so I've given you a lot of information there, a lot of words on that slide, but I'm quite visual. So if I was to summarize it, this is basically what you're doing. It's targeting a particular group of patients to manage their chronic diseases and any public health concerns. Practices are then working towards targets, the care that they have to meet for that patients or those patients, and then in turn, at the end of the year, practices are then rewarded for everything that they've done towards that QOF achievement. So why is it important? It's important for a number of reasons. It does mean that patients are being provided with high quality care. It also means that patients are being provided with consistent care because across England, we're all following the same targets. It also ensures that no patients are being missed out for their care. So if I know that a patient's got asthma, because there's certain targets I need to meet, I won't miss out on the care that is given. And that's same for any of those conditions or any of those public health concerns. It also means that clinicians are following best practice guidance. And like any sort of guidance, from time to time, it will get changed, it will get updated. It's a lot to think about. It's not just QOF that practices have to follow. There's a number of different contracts they have to follow, a number of different guidance they have to follow. So this is just making sure that everyone is keeping on track. It also helps us to monitor performance. So therefore, we can spot any improvement that we need. Do we need to up our game in childhood IMS, for instance? Do we need to get better at making sure that we're capturing patients' smoking status? So being able to monitor our performance, we'll be able to identify all of the improvements that are needed. And it also can provide evidence for practices that they are following good clinical processes. And this is not just important for QOF. I'm sure you heard that every year you would normally have a CQC inspection. So you'll have a team who will come in and inspect all your processes. This is also helping with the work towards that as well. So I hope that makes sense so far. And this is where we're going to go into our first knowledge check question. So the question is, what does QOF stand for? Is it quantity of framework? Is it quality of medicine? Or is it quality and outcomes framework? And I'm going to get Mariette to launch a poll and just give us an answer for A, B, or C. And once we get enough numbers, I will then reveal what the answer is. So over to you, Mariette, for that bit.
Lovely. The responses are coming in, and so far 100% of the audience is picking option C.
Which is correct.
Yay!
So we're on a good start. So yeah, we're on a good start. It does stand for quality and outcomes framework, but like I mentioned, you're never going to use the full name. Even if you mention it in your practice, they'll be like, what is that? Because they're just used to calling it QOF. So just need to note that. Moving on then. So now let's look at the structure. We now understand what it is. We now understand what the importance is. Now let's look at the structure to really help you better understand what you're working towards in your practice. So QOF is broken down into 3 areas. And in QOF terms, areas is known as domains. So if you ever hear anyone saying, oh, I'm working towards this domain, this is basically what they mean. They're working towards a particular area within QOF. What you'll find is sometimes I like to speak really easy because I want to try and help you understand. So if you are finding anything difficult to follow, then just let Hazel know in the Q&A, and Hazel, I'm sure, will correct me. So please do shout out if you need to. So in terms of an area in QOF is known as a domain. And in QOF, there are 3 main areas. So you've got your clinical domain, you've got your public health domain, and then you've got your public health domain additional. Your clinical domain is where we're focusing on the management of those long-term conditions or those chronic diseases. And there's common chronic diseases that practices are working towards. You can see I've put a list just down the bottom there. So there's 13 diseases in total in which practices are working towards those targets. You've got areas such as asthma, AF. You probably notice a lot of these. What's new for this year is this area here called cholesterol. So if you go back and say, oh, I know that cholesterol is new for this year, they'd be quite impressed with you as well. COPD, dementia, heart failure, the list goes on. So really, the clinical domain area is probably the largest piece of work that practices are working towards. You then got the public health domain, and that's where the public health concerns come in. So that's where you're focusing on smoking, obesity, blood pressure, and actually vaccinations is such a big area, but vaccination comes under the public health domain because it's all around that disease prevention. So that's why it comes under there. And then last of all, you've got the public health domain, additional, and this picks up the management of cervical screening. So that ensures that all of the eligible female patients in your practice are coming in when they should be for their cervical smears. Moving on then. So for each of these areas, practices will be working towards a set of targets, and I've mentioned targets quite a lot. But the terminology for targets in QOF is known as indicators. So when we mention we're working towards a target, we're working towards an indicator. So every domain will have a load of indicators included in it. Clinical domain will have more, and then you've got indicators for public health as well. So for example, if we look at asthma, which is part of the clinical domain, you can see there that there are 2 targets that you need to work towards in this area here. So 2 indicators. First of all, for all new patients that have been diagnosed with asthma, they need to have an objective test done 3 months before or after their diagnosis. So that's basically the patients having a peak flow or spirometry if it's available in your area. As well as this, for asthma, practices need to work towards inviting patients in for their annual review, but not only inviting them in for their annual review every year, it's also very clear on what you should be capturing as well. So the assessment of asthma control, recording of number of exacerbations, assessments of inhaler technique, a personalised action plan. So every indicator will be very clear on the criteria and the care that's expected for that particular area. You then got your public health domain that's home in on blood pressure. The target or the indicator to work towards for this particular area is patients who are aged over 45 and they must have a blood pressure done in a set period of time. Now for each indicator, what you will notice is they will have a prefix code. So if you're ever using any of the Ardens templates or reports, or maybe you're looking at your clinical system reports, you may find these indicator numbers in front of anything QOF related. And that's basically helping practices understand what indicator they are currently working towards. So for the asthma review indicator, that is labeled as AST007. For your patients who require the blood pressure done under public health, that is labeled as BP002. So each of them will have a fixed number. Majority of them will stay the same. But every year, remember I said to you that QOF resets. So every year, NHS England may decide that they want to adjust particular indicators. They may want to remove particular indicators. And every time they do that, they will either remove or retire the indicator completely, or they will change the numbering if they've made a change. So for instance, let's say next year, they decide that a review has to be done in just 6 months, and I hope they never ever do that because I know the amount of pressure that will have on you guys. Let's hope they will always stay with 12 months, but let's just say they did change it to 6 months. You will find that they'll probably update the number here. Maybe it goes up to, I don't know, whatever number's not been used, 20 or something, and that's only because a change has been made. Indicator wise, you could have, so if I go back to this slide here, so you could have just a single indicator you have to work towards for a particular area. There could be multiple. I can tell you for sure that diabetes is probably the highest amount of indicators that you have for every area. So there's a lot of work that needs to be done for that. So it just varies depending on what area you're looking at. Now, so far we understand what QOF is. We now understand that it's broken down into areas, and those areas are known as domains. We also understand that practices need to be working towards targets, and targets is known as indicators. So we know domains now, we know indicators. Now, during the introduction, I mentioned that practices are rewarded for any care that they provide, working towards these particular indicators. So rewards are earned by points. So practices will earn points for everything that they do, and at the end of the year those points will turn into payment. So across each of the domains, there'll be a total number of points that practices can work towards. Remember I said to you that the clinical domain is the largest area, so you can earn up to 437 points in this area. Public health drops down to 104, and for your additional service, that drops down to 11 points. So the total number of QOF points that can be earned by any practice this year is 582. And again, it varies every year. They can reduce the number, they can increase the number. Again, it just depends on what NHS England's focus is. Within each of these, so this is just telling you the total for each domain. Within each of these then, this number is then split between each of the indicators. So if I home back into asthma as my example, although asthma is part of clinical domain and there's 437 points that you can earn, 35 of those points go towards asthma. 20 of them is for doing the review every year, and 15 of them is for the other indicator that I mentioned. The QOF point actually has a value attached to it. So every point for this financial year is £227.95. Can you see what I mean when I say it's a significant impact in income to your practices? It's a lot of money that you're actually working towards, as well as caring for your patients, which is the most important thing too. I hope that makes sense. Now, we don't always live in the perfect world, unfortunately, and as much as we set our intentions at the beginning of April, we're going to get full points in every area. Sometimes that doesn't always happen, and that can be out of our control. It could be that we can't offer the service. It could be that patients are not coming in. So therefore, we're trying, but we can't quite reach full points. So this is where NHS England have put in minimum or maximum targets that we can reach. And in QOF terms, those are known as thresholds. We've had domains, we've had indicators, now we're looking at thresholds. So what the thresholds is doing is allowing you to work towards as much as you can. If you can at least reach minimum threshold, then you're going to get some of those points. You're not going to get the full 15 in this example, but you'll get some of them, depending on what work you've done. If you've reached full points, then you'll get your whole 15 points. If you've not reached that threshold at all, then unfortunately you're not going to get any points. So what you'll find is practices will they will be aiming for full points, but if they can at least get to minimum or just below maximum, that's good enough as well. You're still going to get points for that particular area. Every indicator has a different scale of a threshold. So the minimum threshold to reach for this particular indicator is at least 45%. The maximum is 80%. And I'm going to have a breather now, and we're going to have a look at another knowledge check question. So the very first one then, and Mariette's going to put out the poll. What is the structure for QOF? So think about all of the terminology that I've mentioned to you so far. Is it areas, targets, percentages? Is it appointments, events, or is it C, domains, indicators, and thresholds? And Mariette, if you don't mind just popping that poll up and let me know what the answers are.
Lovely, I've just launched that one. So majority of the audience have gone for C, and some people have said A.
Okay, correct answer is C. For those of you that got domains, indicators, and thresholds, those are your key terms that we use within QOF. Even though I've mentioned targets a lot, it's me trying to help you understand that in real life context, but the actual terminology for QOF is indicators. Areas, domains, indicators, targets, thresholds is those minimum and maximum targets that we're working towards. Next question. Oh, I've revealed the answer too quickly. Move back. Next question. How many points are available across all three QOF domains? Let's hope you weren't quick, and let's hope you generally know what the answer is. So is it A, 1,000, B, 582, or C, 249?
The majority have said B, and a few people have said C.
Okay, the correct answer is B, which is 582 points in total that you can work towards for QOF this year. And remembering it does vary as well. I think I'm going to take a breather here and probably check in, because we've already done 25 minutes already. Is there anything that you want to add, Mariette, on what we've spoken about so far, or any questions in the chat that you or Hazel want to share at all?
No questions in the chat that I have seen.
Okay.
But no, nothing to add really. I think you've explained QOF in very simple terms. It is a lot to get your head around because there is so much with it all. So no, you've done a really good job of breaking it all down into those key areas and terminology.
Cool. Please, if there are any questions that you would like to answer us, Hazel's there ready. She's got the business rules up ready and waiting. So if there are any questions, anything that you're stuck on at the moment, please do reach out to us. Okay, so moving on then. So we now understand how QOF works, hopefully, and we are now looking at how you actually capture data. And this is such an important part of QOF because in order to earn points for each of these indicators, we do need to provide evidence that we've done it. And this means that we have to be recording data in the correct way. So just up the top there, it says practices must provide evidence that indicators have been achieved. And the way that you do that is you enter a code in your clinical system. So whether you're using EMIS or System 1, actually, we didn't answer that question. It might be worth firing that question up, Mariette, to see how many practices are EMIS and how many practices are System 1. Should we just quickly do that now?
Yeah.
Because that would be quite useful when we look at the next slide.
Bear with me one moment.
While you're doing that, can I jump in?
Go for it.
We've just had a couple of questions, the same question for a couple of people, and I don't know if you're going to cover it or if it's too in depth. They're asking about the value of the QOF point. Are we really going to get that much per QOF point? And I've just put it will vary depending on the size of your practice and how common the condition is. You're going to cover that in a bit, are you?
I am, very briefly, but that's exactly right for anyone else that has that same question. It does vary on a load of different things, and which we'll cover. Thanks, Hazel.
So half and half, we've got an even split between EMIS and System 1.
Okay, cool. Perfect. That just gives us a good idea for the next slide then. So yeah, moving back to how QOF is captured, it's just so important that you are recording the codes correctly in your clinical system. Free text does not count. So if you've got someone in your practice, and I remember when I used to go out training, I used to train on EMIS quite a lot, and I used to go out and I used to see practice managers or senior admin teams like tearing their hair out because there was GPs, and I'm sure it's not the GPs we have in the room here, but GPs who would put free text into the patient record, and they're like, please don't do that, because as soon as you put free text in, it's not going to be recognized by QOF, you're not going to get your points, you're not going to get paid. So it's really important those codes are going in. And when I say codes, it also has to be codes that are recognized by QOF. That's so important, and we'll have a look at that right now actually. So when you're entering a single code in the patient's record, there is an easier way, and I'm going to show you in a minute. When you're entering a code, it's very, very important that you're looking out for anything that has the QOF symbol on the right hand side. So this is a System 1 screen. You'll probably recognize this. This is the EMIS screen. It works very similar as well. So for both EMIS and System 1, it will have the yellow QOF sign on the very right hand side of the description. So for the asthma medication review, in order to say that I've definitely done that, these are the codes I should be using. But we suggest always refer to an Ardens template, because if you're using an Ardens template, all we're putting in there, particularly for our contract fields, is the fields you only should be using for QOF and nothing else. So this example here, we've got the asthma templates. For the EMIS practices, this is your one here. You'll have the contracts QOF page. As soon as you come into the contracts QOF page, it will outline the register requirements and also the different indicators. So remember, I said to you at the very beginning, there was 2 indicators you were working towards for asthma. The first one is making sure you get the objective test done when a patient is newly diagnosed. The second one is having that asthma annual review done, and all of those different elements that NHS England are expecting you to do. So therefore, use the template, and then your staff will be using the right fields. Just make sure that everyone is aware of how they use the Ardens templates, where they find them. We've got a template for every single one of the long-term conditions to help you with the clinical domain. We've got templates and resources for vaccinations, cervical smears, absolutely everything. It just makes sure that you are on track. So that's the EMIS side. There will be a star as well against anything that is contract related. Mariette, do you want to explain the System 1 side, because you're probably more of an expert on that one and how that
Yes. Yes, of course. So the template that is on the screen at the moment is just the QOF template, and that will show you just the key areas of QOF that you need to capture. But for those clinicians who would complete, let's say, the asthma review, you would use our normal national asthma review template, and that will have all of that best practice guidance on there to capture the key things around your asthma consultation. So when you're using that particular template, you'll notice that anything with a red star is linked to QOF. So these little indicators you can see on the QOF template will be embedded into that asthma review template. So do look out for the little red stars, which will indicate the QOF indicators on there, so you can be sure to capture that coding. So everything is fully interactive with smart templates.
Thank you, Mariette. Okay. What if there are times that you cannot provide the care for the patient, and there may be a number of reasons for that? So in QOF terminology, what you can enter in the record is something we call a personalized care adjustment. And this is applied to the patient record. And this is basically us saying, look, we try to provide the care for the patient. We have all intentions of trying to support that patient, but for some reason, and there has to be qualified reasons for this, we are unable to do it. So here, list out the only reasons you should be using, the only reasons that will be accepted by QOF. So the first one is where the service is unavailable. So this year, the biggest thing has been obesity. You may have heard a lot of your practice staff talking about obesity requirements they need to follow for this year, because it is new and updated for this year. Part of one of the indicators is patients being eligible to have the weight injection, which I'm sure you've heard lots of information over the press and everything else, but they have to meet a certain criteria in order to have that weight injection. Not every area offers that service. So rather than those practices being penalised because they don't actually offer the service, there's nothing they can do, it's out of their control, this is where they can apply a PCA code. It used to be called exceptions. You might have heard the term exceptions before, but very much now it's called PCAs, or personalised care adjustment. So if I am trying to meet that indicator, but the service is not available, I can enter, and in a minute we're going to show you where to do that. You can put a code in to say that the service is unavailable. What other things, Mariette, do you think for service unavailable? Spirometry, maybe? Is there anything else?
Tends to be spirometry, sometimes with diabetes education. I think there's one for service unavailable.
Okay, so there could be quite a few then, depending on the area, I suppose. Okay. Next reason here is some indicators may require certain medication to be issued for that patient. If the patient has an allergy to it, or they can't tolerate that medication in any way, we're not going to force the patient to do it. Although it's part of the indicator, again, we don't want to penalise you for trying, but you can't because the patient can't tolerate it. So there is a reason you can put in there, the intervention is clinically unsuitable. That may also be known as a contraindication. So if you hear the word contraindication, that's basically what it means. It's not suitable for that patient. You've also got the choice there if the patient actually refuses. You've tried to offer them, but they just don't want it. So therefore, you can put a decline code in. So for those three here, you have to physically put the code in order for it to be recognised in QOF that you've tried, but you cannot provide the care for that patient. These bottom two here are actually automatic. So the system works it out and it applies it automatically. So every year, we're inviting patients in for an annual review. And that is where you're going to get the majority of the QOF work done, which is why it's so important that we have a real good recall system in place to recall our patients in every year, because that's where you're going to get most of your QOF activity done. What will happen, and I'm sure most of you in the room might actually do this, you will send an invitation out to the patient, asking them to book their review. Some of them really good, some of them even proactive and actually ringing you and saying that they need an annual review in. But there are some patients, hopefully not many, who you've tried to send invites to, but they're still not responding. So in QOF, what happens if it sees that you've tried to send out 2 invites and it gets to the end of the year and the patient still has not had the care that they need, then there's an automatic PCA that will be applied to that patient. Again, it will then prevent you for not getting the right payment that you should because you've tried. The other one is the patient has registered with the practice in the last 3 months. For some indicators, it could be the last 9 months. It depends on just what area it is. Or perhaps you've only just diagnosed them in the last 3 months. Because what we don't want to happen here is it happens all in the last 3 months, and all of a sudden you've got all of this work that you need to get done by the end of the financial year. It's just not realistic, particularly when you've got areas such as diabetes that covers so much information. So therefore, an automatic exception or PCA will go into this patient's record, or the patient will not be counted if they've been newly diagnosed or if they are a new patient in the practice for the last 3 months. I hope that makes sense. So these two are automatically applied. These 3 here, you have to record in the patient record. What that looks like, again, notice I'm going back to the Ardens templates because this is your Bible when it comes to QOF. This is where you're going to find all of the codes that you need to. For both the EMIS and System 1, you will have the clear options in there with all of the relevant personalised care adjustment codes you can use, because this can vary across each of the indicators as well, or each of the different domains. So therefore, you can see here that there are codes that you can be applying. And as soon as that goes in, the calculation will work out what it needs to do. Important that you code it. So this then moves on to how we actually monitor it. I hope you're kind of getting the understanding now that QOF is such a big area, and it does take up a lot of time, and it does take up a lot of our workforce as well. So it's really important that practices are spending time at the beginning of the year to plan how they're going to tackle QOF throughout the year, to plan how they're going to monitor the progress throughout. And your clinical system providers, they will provide you reports within the clinical system, and they're not been updated just yet for this financial year. So therefore, the Ardens resources are all updated for you for this financial year, so you can keep on track already. So within your clinical system, it's just worth noting that we have the contract QOF folder, so both for EMIS and System 1. If you're an EMIS customer, you're looking out for 5.19 contracts QOF. If you're not, if you're a System 1 practice, you're looking out for the contracts 26-27 QOF folder. Hazel, if you can share the support, or Mariette, if you can share the support article, that'd be great. So you can use the reports here to understand how you're achieving, and you can understand what is still outstanding for each of those indicators. And now that you've got a bit more understanding of QOF, if you go away and have a look at these reports now, it's going to make so much more sense on what you're trying to achieve. Some of you may have our other product, Ardens Manager. And what this allows you to do is monitor progress for your practice. It can also be compared across different practices, PCNs and ICBs as well. And it will let you know exactly how you're doing. It gives you more of a visual. If you're a real visual person, then Ardens Manager is going to be great for you. It will let you know, I know the screenshot's quite small, it will let you know exactly where you meet the thresholds. It will tell you how many points you still have remaining, and it will also turn that into payment. So if your practice wants to prioritize in any way, they can use Ardens Manager to be able to do that. How do practices get paid for QOF? I've put a really confused emoji on there because, like anything, the calculation is complex. But I just personally feel that you don't need to worry about that. I think you just need to worry about making sure you understand what you need to do, understand what the practice needs to do, understand what part you play. I think calculation sides and the working out is normally with your management team. A lot of it is done automatically. But like Hazel mentioned earlier, it's not just a case of you get that exact sum. It does take in other considerations. So it's looking at the size of your practice. It's also looking at how many patients have got that condition in that particular area. It's also looking at the number of points you've achieved, and it's also looking at value of a QOF point. So it will vary across practices. None of you are going to get the exact same income at the end of the year. It will vary depending on these different factors. So I think I'm going to leave it as that because it is quite complex. But again, just a bit of visual. What will then happen is on the 31st of March, that's when your QOF year ends. Around that time, the information, so all of the data that you've coded will be automatically extracted out of your system. This is all done automatically. It goes into a platform called GPS, which is then transferred across to a platform called CQRS. I told you it was complex, didn't I? It is complex, but just know that all of this is being done in the background, but it's just important that we're recording all of the activity by the 31st of March. That's very, very important. Where do I think we're nearly coming to an end now? So at the start of the meeting, I let you know that every role plays a vital part in QOF. When we're all working as a team on this, we're going to be able to maximize as much income as possible for the practice. We're going to make sure patients are receiving that high quality care, which is the whole aim of us doing this bit of work. So the data even that you input, I know we've got a lot of administrators on here today, but even the data you input could also be working towards that QOF achievement too. So for instance, by you entering smoking, ethnicity, blood pressure, alcohol status, height, weight, invite codes, these are all working towards achievement. You're doing your part to help your practice earn that income. So don't forget that. You're just as important as the clinical team entering the data in the system as well. But we just need to make sure that we are accurately recording it in the patient's record. It's really important. Refer to the Ardens templates. They will help you. Clinical staff, yes, you have got the main bulk. For you are completing and recording those annual reviews. Just please do make sure that you're not missing out on anything. Again, refer to the Ardens template. And also as well, deliver and record QOF related care wherever there is an opportunity. I've wrote that there. I went to a practice yesterday and we were looking at a QOF plan for them for the financial year ahead. And this practice manager, and I'm sure most of you are the same, she knows her patients very, very well. So we were sat doing the session and she could hear one of the patients come up to the reception desk. She knew exactly who that person was. She quickly went into the notes. She noticed that smoking needed to be updated for that patient. She quickly then ran to reception to see whether she could get the smoking status updated. But this is what I mean. Take every opportunity to make sure that you are recording that QOF activity. And then for your management staff, they're monitoring QOF progress and performance throughout the year. They're identifying gaps and they're supporting team to improve on the achievement for QOF. And that takes me to key takeaways. So we're nearly there now. Hopefully you have been able to take a lot from that. Hopefully you've been able to understand it all. I'm going to answer you a few more questions in a minute, so please don't go anywhere just yet. It's really great that we've still got 90 of you in the room today, so we really do appreciate that. But in terms of key takeaways, it's just remembering that QOF helps to improve the quality of care. It is an incentive program, so like I mentioned, practices will be rewarded for the work that they're doing and delivering that high quality care. Clinical coding is so essential for QOF activity, and QOF is broken down by 3 domains: clinical, which is your largest one, public health additional. Remember, public health additional is where cervical screening fits in. Points are awarded, so every time you work towards it, you record the evidence you've done it, you get points, and at the end of the year, you'll get payment for that, but that will vary depending on a number of factors that we've mentioned. And every role, so all of you, can contribute towards QOF achievement. So really, when you walk away today, think about, how can I be helping out more? Can I encourage patients to make sure they have their updated blood pressure, height, weight, BMI? Can I make sure they have their updated alcohol status? Because all of this can play a part in recording QOF activity. So that leaves us with the final knowledge check. So Mariette, if you get ready for the next 3 questions. So the first question, QOF helps practices to improve the quality of patient care or organise practice appointment books. So let us know whether that's an A or a B.
So 100% of the audience have gone for A.
Okay, perfect, correct, that is right. Next question, QOF runs between the 1st of April to the 31st of March or the 1st of January to the 31st of December.
And 100% correct on that one, A.
Perfect, thank you. Correct. And then the last one, the 3 QOF domains are clinical public health quality improvement, or clinical public health additional.
And the results are starting to come in. So majority of the audience have gone for B and a few have gone for A.
Interesting. That is a trick question though, and there's a reason why I've done that. The actual answer for this year is B, but actually in previous years they had quality improvement. So that's maybe why we might have a mixture of the 2. So for this financial year it's clinical public health and then public health additional. Thank you for that. Right, so that just leaves us with next steps then. So where can you go from here? We are going to also answer another question about your confidence level in a minute. But from here, where can you go? Now, you've joined this session today. Hopefully you found it useful. We do have an Ardens Academy course online that you may want to complete and refresh your skills. So it covers the same content, but it allows you to learn in your own time. And you even get a certificate at the end. So you may want to complete that. And we'll put a link in on how you can sign up for that. You now may want to further enhance your skill. You may have the QOF vibe now, and you may want to go even further. So have a look at our support articles. We've also done some webinars this year on what's updated for this financial year for QOF and how we can help you. So think about your next step. We're also doing a webinar on Tuesday on building a QOF plan, which you might find quite useful as well. I'm going to get Mariette to quickly just launch that last question then on what you feel your confidence level is now that you've had the training. What was it before? Was there a lot of 2s and 3s and 1s and a couple of 5s?
Yeah.
Okay, so it'd be interesting to see where you are now.
Oh, that's good results. So the majority of the audience are now 4s and 5s.
Perfect. Brilliant. Brilliant, brilliant. That leaves us lastly then with training and support. So if you feel that you want more training on QOF for your practice, perhaps there's a couple of things that you've seen on there and you think, well, actually, no, the rest of our staff can actually do with that, then contact our training bookings team. You can contact them at training@ardens.org.uk and they'll be able to arrange some training for your practice. You can also contact our support team. So if you need any help in real time, then it's support@ardens.org.uk and they'll be more than happy to answer any questions that you may have. We will make sure that we email all of this out for you as well. And that just leads us to the last slide now, which is your feedback. We always value your feedback, not just on how it was delivered today, but also the content, the resources. I touched on the resources as well. Let us know if there's any other training you feel that you may want. So you can either pop that in the Q&A or you can fill out your feedback form. But yeah, just really want to say thank you very much. Mariette, Hazel, any last minute questions or things that we want to discuss before we close?
I'm just waiting for my Q&A to refresh. Hazel, is there anything in the Q&A you think would be worth bringing up?
No. Lucy's just asked about, will the slides be out? I'm presuming that they come out with the recording as well.
Yeah, they will do. They will go out as well.
And yes, the ones next week will also be recorded. So all our webinars are recorded. So don't worry if you can't attend, you can watch them back later.
Perfect. Thank you very much. Okay, we're going to leave it as there. You get 10 minutes back of your time. So thank you so much, everyone, for joining us today. And hopefully we'll see a lot of you on the future QOF webinars. Hope you have a good day and we'll speak to you all soon. So bye for now. And it's just the red leave button on top right hand corner to come out of the meeting. Thanks, everyone.